Welcome friends and viewers on MuniMeterHealth, your favorite source of learning about the human heart and cardiology. One step at a time, we are educating the medical fraternity and the patients to improve the clinical outcomes, as you see. So here we are, very briefly on MuniMeterHealth. Today we'll discuss heart valve implants and devices. What are they? Well, we have discussed the valves on a previous occasion, but let's understand what the implants are. Implants or heart valve implants or devices are structures which are placed by the surgeon inside the heart when the valve in suspect is actually not opening fully or not closing fully. So not opening fully is called stenosis, and not opening completely is also called regurgitation. So just so that you know, so let's draw a quick schematic to understand where we are with our the positions of the valves. So having understood that the heart has 4 chambers, and having understood that the heart has therefore 4 valves, we'll draw the valves slightly in a different color schematic. This is the tricuspid valve that has 3 leaflets. This is the mitral valve, and then of course you have the pulmonary artery here and the aorta here, which will have its own valves, and we'll show them in slightly different color schematic here for you. So we have 4 sets of valves: tricuspid valve, mitral valve, this being the aortic valve, and this being the pulmonary valve. Now, any of these valves, if they're not opening fully, will actually result into what is called stenosis. So remember, not opening fully, not opening fully. So when it does not open fully, it's called stenosis. Now it could be tricuspid stenosis, pulmonary stenosis, mitral stenosis, aortic stenosis, and so on and so forth. Okay. Now if they are not closing fully, so now not closing fully, and that is not closing fully, and this is not opening fully. So these are called regurgitations. So a regurgitation implying that the blood is now coming back into the chamber, the previous chamber. Remember, when it goes back into the previous chambers, that is a regurgitation. When the blood is not able to squeeze through because the valves are extremely narrow, if you will, or extremely, like we can show them the narrowness, then it's called stenosis. So stenosis disallows the blood to go forward, and regurgitation brings the blood back into the previous chambers. So these are the 2 major malfunctions of the valves for which a valve device or an implant may have to be done. Remember, it's an open heart surgery, so the person will have to be in the hospital, will have to be admitted, and therefore in the operating room it will be performed under general anesthesia. It's a major surgery, so the person has to be in real good shape in order to be cleared for open heart surgery, as we call it. Now, we have perfected this open heart surgery over the decades, just so that you know, so there's not a great deal of worry in that regard, because the cardiologist and the surgeons both will confer with each other and make sure that the person is fit enough to undertake this open heart surgery. We are moving towards minimally invasive surgery as we proceed in the future, and presently now it's being performed without opening the heart, and we'll discuss all of that in the next video again. But just so that you know, the heart valve implant devices are placed right here. Say if this valve is malfunctioning, or the aortic valve is malfunctioning, or the mitral valve is malfunctioning, one tends to put this implant here, and the surgeon has the expertise to perform that level of surgical procedure. So the procedure is called heart valve surgery, whether it is say mitral valve replacement, we call it MVR. In this setting it will be called the aortic valve replacement. So whether it's mitral valve replacement or aortic valve replacement, sometimes more than one valve could be involved, 2 or 3. As we know, there are 4 valves in all, which are basically functioning within the heart to separate one chamber from the other and provide only one directional flow, that is forward flow. Whenever any of that malfunction occurs and the patient starts to have symptoms like shortness of breath, chest pain, palpitations, or even dizziness or passing out spells, and the cardiologist and the surgeons confer with each other and they decide that these symptoms are related to the heart valve problems, then at that point a heart valve implant or device is indicated. Okay, so hope you understood the basics of heart valve implants and devices through this discussion. Keep learning on MuniMeterHealth, and looking forward to seeing you again on my next